episode of Dr. Ozello's Sports Medicine Report, I am going to cover patellar tendinopathy. Patellar tendinopathy is pain, tenderness, and swelling in the tendon that is located just inferior to the patella. This condition is nicknamed jumper's knee. This is a common condition. This is an overuse condition that can be prevented. Prevention is the key. If this does occur, there are many things that an athlete can do to help to rehab from this condition. Patellar tendinopathy is a serious condition that is located just inferior to the patella. It's pain, tenderness, and swelling in that area, and it is an overuse injury. The patella is classified as a sesamoid bone. The patella is the medical terminology for the kneecap. The quadriceps are the big, strong muscles in the front of the thigh. When the quadriceps contract in a positive, or what is medical terminology, concentrically, they extend the knee. The tendons from the four strong quadricep muscles come right down here. The patella sits inside that tendon. The tendon, when it is above the patella, is called the quadriceps tendon. The tendon, when it is below the patella, is called a patellar tendon. That is where the pain and tenderness and swelling of patellar tendinitis is located at. The tendon attaches right up here in the bone in the front part of the tibia. This condition is an overuse condition. It is caused by exercises and motions such as walking, running, jumping, sports where there is a large amount of high ballistic knee extension. Sports such as when we jump a lot, volleyball, basketball, when we kick a lot, such as soccer and kickball. Also activities like dancing. Also weightlifters, people who do a large number of squats. This is a common condition that they get because there is that high ballistic motion which is creating a lot of tension on the patellar tendon. Now what the kneecap does, what it functions to do, is that it helps to increase the leverage of the tendon and helps it to function better. So this is a condition where it is best prevented, and if it does occur, then there are many things that can be done to help to rehab from this condition. Modifying the training, eliminating the extrinsic factors and the intrinsic factors of patellar tendinopathy. The symptoms of patellar tendinopathy are located just inferior to the patella in the patellar tendon. These symptoms include pain, tenderness, and swelling. Usually when this condition begins, the symptoms are only felt after the activity. As it progresses and becomes worse, the symptoms are felt when we commence the activity, then they kind of disappear, and then they'll come back after activity. But as it progresses, it becomes more frequent, and we're to a point where it's almost constant. This is something where once the symptoms begin, you should take action. Begin action immediately. Do not hesitate. These symptoms, if someone tries to push through the symptoms, it can create more damage and lead to a chronic condition. We want to avoid that at all costs. Like I mentioned before, prevention is our number one goal. If symptoms do occur, take action immediately and eliminate the extrinsic factors and the intrinsic factors of patellar tendinopathy. Tendinopathy is a term that means a disease or disorder of a tendon. Patellar tendinopathy is a condition that can happen to athletes of all ages and all levels, but it is most common in athletes who are skeletally mature, meaning adolescents who are maybe age 16 all the way up to adults, ranging usually from age 16 to about age 40. Like I said, it can happen to athletes of all ages and all levels, but age 16 to 40 are the most common. Patellar tendinopathy is an overuse injury. Therefore, the mechanism of the injury, what causes the injury, is the cumulative effect of repetitive loading. The athlete is doing too much too soon with inadequate rest that is causing that is placing too much stress on the patellar tendon and causing the injury. Every type of overuse injury has extrinsic factors and intrinsic factors involved. Extrinsic factors include doing too much training, inadequate rest between training sessions and or competitions, and the intrinsic factors are some type of biomechanical fault. Those three things occur in every overuse injury. When we are speaking about a biomechanical fault, it can be a strength imbalance, it can be muscle weakness, it can be muscle tightness, it can be limited range of motion. All those type of things play a factor. The intrinsic factors in patellar tendinopathy are two very distinct things. First of all, a strength imbalance between the hip flexors and the quadriceps as compared to the hamstrings. The hamstring muscles are weak and inflexible compared to the strong quadriceps and the strong hip flexors. Also, the Achilles tendon and the calf muscles are very tight, and it is limiting the motion of dorsiflexion, which is when we pull the front part of the toes towards the knee. So those two intrinsic factors that occur in the body are causes for patellar tendinopathy when we combine those with the overtraining and the inadequate rest between training sessions. The type of training or the type of activities that cause patellar tendinopathy: too much jumping, too much squatting, too many lunges, improper lunging technique, running, when we talk more of running uphill and downhill, and running stairs where we're going up the stairs and down the stairs. Now those are all great exercises, but you have to do them in the proper amount, and you have to modify your training so you're doing cross training and doing a variety of things. If you're doing too much of one of those activities or several of those activities, and you're not resting between your training sessions, and you have a intrinsic factor that causes patellar tendinitis, if you have the quad dominant, where the quadriceps and the hip flexors are strong compared to the hamstrings, and if the Achilles tendon and the calf muscles are very strong and they're limiting dorsiflexion, that is a combination that sets someone up to receive and start to develop patellar tendinopathy. Prevention of any overuse injury can be achieved with smart training and the elimination of the extrinsic and intrinsic factors. Prevention is easier, faster, and much less expensive than injury rehabilitation. Trust me, I know. I see it every day in my office, and I have suffered overuse injuries myself, so I know firsthand. The prevention of an overuse injury such as patellar tendinopathy is done by eliminating the extrinsic factors and the intrinsic factors. I spoke about the intrinsic factors of patellar tendinopathy being quad dominance, meaning that the hip flexors and the quadriceps are much stronger than the hamstring muscles. And also the hamstring muscles, besides being weak, they may be inflexible. Then also the calf muscles and the Achilles tendon are very tight, and it is preventing the ankle from moving into dorsiflexion. So we eliminate the intrinsic factors by performing stretching exercises for the hip flexors, for the quadriceps, by foam rolling the hip flexors and the quadriceps, and by strengthening the hamstring muscles. There are numerous hamstring exercises that you can perform that will help to strengthen those muscles. The quadriceps and the hip flexors can be stretched in a variety of ways. Use those stretches, use the strengthening exercises for the hamstrings to your advantage. Quad dominance is a condition that can prevent several overuse injuries, including patellar tendinopathy. So help to eliminate that, before the symptoms even began. Eliminate this troublesome intrinsic factor by strengthening the hamstrings and by stretching and foam rolling the quadriceps and the hip flexors. Also, you want to make your hamstrings as healthy as possible. Like I spoke about, strengthening the hamstrings, yes, but you also want to stretch the hamstrings so that they are flexible and that they perform better when you are running. Stretch the calves and stretch the Achilles tendon. This can also be done in numerous ways. Work very methodical. Whenever you stretch, you want to make sure that you are not overstretching. Hold a mild, comfortable stretch. Do not overdo it. When you start to stretch too far and pain begins, the muscle automatically contracts. That is a reflex we have. When the muscle is contracting, it cannot be stretched. So when you stretch, you want to make sure that you move very slow and you hold a mild, comfortable stretch. So you want to stretch the calf muscles and the Achilles tendon, and you could also perform strengthening exercises that help to move you into dorsiflexion. Those can be performed with a resistance band. Now the extrinsic factors. The extrinsic factors is all about training smarter. Develop a routine that is well-rounded, where you're still concentrating on the activities that you want to do and that you want to improve at, but you need to do other things also, okay? If running is your thing, yes, running, you should run and believe in yourself and have fun when you are running, but you want to do other exercises also. You don't want to do the same routine repeatedly over and over again, because that stresses the muscles and the joints in the same way and leads to injury. So you want to do something else. Maybe you could get on a bike, you could get on some exercise equipment at the gym, you could get in the pool. All types of things are available. So I recommend that to you is to change up your routine. The same thing goes with strength training. If you do a lot of squats, you want to modify your training so that you may be using a different stance. You may have a wider stance sometimes, you may have a more narrower stance. You may want to apply other exercises to it. Lunges are the same type of thing. Lunges are a fantastic exercise for strengthening the lower extremity. You want to make sure that you use proper technique, and you want to do different types of lunges. You can do the straight drop down lunge, you can do the forward lunge, you can do the reverse lunge. All those target the same muscles, but they do it at a slightly different angle, which means that the muscles in the joints will not be stressed in the identical way each time that you perform them. When you are doing lunges, two very important factors. One, you want to make sure that the forward knee does not go forward of the foot, meaning that whichever leg you have anterior, you want to make sure that you are dropping straight down and this knee is not sliding in front of the foot. The second factor is the posterior leg, the leg that is in the back that is bent. You want to make sure you do not bang it on the floor. Rest between your training sessions. Perform your active recovery between your training sessions. It is going to help to prevent this injury. Do everything you can to prevent all types of overuse injuries, including the topic for today, patellar tendinopathy. Eliminate the extrinsic factors and the intrinsic factors, and that will help you a great deal in preventing patellar tendinopathy. Other factors that are going to help you to prevent patellar tendinopathy are a proper warm-up and a proper cool-down. The warm-up is essential. The warm-up is the time period where we prepare our body for training. It's a transition period where we're taking our body from a non-active state to an active state. Make sure that the muscles that you're working, especially the lower extremities, are warmed up very well. The cool down. The cool down is a great time to perform slow static stretches, going to help you to increase flexibility. The 10% rule. The 10% rule is a key factor in training. The 10% rule means that you do not increase the intensity of your training more than 10% each week. Now, 10% doesn't seem like very much. but it is a great standard rule. Because what happens is if we try to do too much, if we try to increase the intensity of our training, say running for instance, we try to do more hill work, or we try to do more speed work, or more distance, the body is not used to that. And it starts to break down, especially if we're not giving it adequate rest between training sessions. So you increase your intensity by only 10% or less each month. Now it doesn't seem like much, each week, I'm sorry, but it doesn't seem like much. But then you think about in 6 weeks, that's a huge increase, and the body has been given time to adapt to that. So those are 3 key factors in the prevention of patellar tendinopathy. Proper warm-up, proper cool down, and increasing your intensity by very gradual increments, no more than 10% each week. If symptoms should occur, act immediately. Do not try to push through the symptoms, because it's only going to make the condition worse. I had mentioned before, when athletes try to push through patellar tendinopathy, it can create a chronic condition. No one wants a chronic condition because it's going to limit things that you can do throughout your entire life. So if you start to feel symptoms, take action immediately. Seek professional care. Do not hesitate. At least get an evaluation. A proper diagnosis will come through that evaluation, and that will lead you in the right direction. As a doctor of chiropractic, I have treated numerous people with patellar tendinopathy. What I do is I look at the entire kinetic chain, starting at the bottom of the foot, going all the way up. I look at the spine, the nervous system, starting from the brain, going down the spinal cord, going all the way down. The chiropractic adjustment is going to help to restore proper motion to the skeleton. It's going to reestablish that proper motion, and it's going to optimize the nerve flow. Also, patient education. That is what I'm talking about right now. That is what this video is about. I talked about the prevention, but if symptoms do occur, when you are doing your self-treatment, you want to stretch the hip flexors and the quadriceps. You want to strengthen the hamstrings. You want to stretch the calves and the Achilles tendon. You want to foam roll the hip flexors and the quadriceps. You want to foam roll the calves. Do whatever you can to help to eliminate the intrinsic factors that cause this condition. The extrinsic factors, obviously you're going to need to modify your training. If you're a runner, you may need to stop running and jump on the bike or get in the pool. You may need to modify your training. Say if you're running hills or running stairs, you may need to stop that for a little bit and run on a flat surface, or maybe trail running, something of a different aspect of a different way of attacking those muscles, where you still keep your heart, your lungs strong, you still keep your body conditioned, but you're not stressing the tendon the same way. In conclusion, first of all, I want to thank you, the viewer, for watching today's episode of Dr. Ozello Sports Medicine Report, where I covered patellar tendinopathy. Please feel free to leave questions, feedback, and suggestions in the comments section. Patellar tendinopathy is a chapter in my book, Running, Maximize Performance, and Minimize Injuries. It is chapter 12, page 76. Patellar tendinopathy is a condition that is common among athletes. That's why it's named jumper's knee. You see it all the time with athletes who jump a great deal. You want to make sure that you eliminate the extrinsic factors and the intrinsic factors. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Train hard, train smart, stay injury-free, and accomplish your goals.